horrible, can I say regime? Is that appropriate in this situation? I think regime is an appropriate word. So we got a lot of people who are coming up to speak. Steve, would you like to speak first? Steve Woods with ACR. Everybody give it up for him. ACR Health here.
Well, good afternoon, everybody. My name is Steve Wood. I am the Director of Insurance Programs at ACR Health. We are based here in Syracuse. We serve 9 counties. I run a very large Navigator program, which helps enroll people into New York State of Health or the Affordable Care Act. Woo! Oh, thank you. Thank you. In the 3.5 years that we have been running this program, we have enrolled 30,000 people into affordable, comprehensive health care that otherwise would not have been available to them until the Affordable Care Act. And I got into this 5 years ago, before the Affordable Care Act. ACR called me and said, do you want to come educate people about health care reform? I said, oh my God, no. Right? But I needed a job. But I needed a job anyway, so I took it. And you would never realize what passion you can have around health insurance and giving people health and getting them hooked up with physicians and with care. And the people that have come to see us, those 30,000 in 9 counties, people with chronic illness, people with terminal illness, people with children with chronic illness, who have come to us and have gotten health care and hopefully have gotten healthy. The one thing I want to talk just for a moment about, though, is what the foundation of the Affordable Care Act is. What this is built on is reducing emergency room visits. That really is what it began with. And that's what it has done wonderfully, is reduce those emergency room visits, because once the emergency room visits start happening and people can't pay for those bills, who pays? We do. And that's what we're going to go back to. If you repeal the ACA, emergency room visits and urgent care visits explode again. And there we are. We're paying for care that people cannot afford. The other things that go away. Have you had a mammogram this year or a pap smear? Did you get a colonoscopy? Did you pay for it? No, you didn't. That goes away with ACA repeal. All preventative care, your physical, your vaccinations, HIV testing, hepatitis C testing, a whole ton of pregnancy-related stuff all goes away. Contraception, free contraception goes away. We all think that this relates to New York State of Health or the marketplaces, healthcare.gov. It doesn't, because the ACA affects every single one of us. If you have employer-sponsored insurance, it affects you because your preventive care is now going to cost you. Your prescriptions are going to cost you more. Those 10 essential health benefits are gone. Mental health will now be limited again. Right now you have an unlimited cap on mental health services and substance use treatment and things like that. That's part of the ACA. That goes back. Pre-existing conditions. It's back. They can deny you if you have cancer, if you have diabetes, if you have asthma. If you've been a victim of domestic violence, that is considered a pre-existing condition, and they can deny you health insurance. If you have had a mastectomy and you want reconstructive surgery after, that will be considered cosmetic surgery. Right now it's covered. That goes away. But you know what? Medicare. For all our seniors. A lot of seniors are saying, oh, well, I don't care about this, but don't touch my Medicare.
They're about to.
They're about to, because that is also built into the ACA. Has anybody ever heard of the donut hole?
Yeah.
It's not what they're selling across the street at Dunkin' Donuts. The donut hole is a coverage gap. When a senior hits about $2,500 in out-of-pocket prescription costs, their prescription coverage stops, and they are responsible for the full cost of their prescriptions until they hit $4,800. That is unreasonable for seniors that are on Medicare and on fixed incomes, isn't it?
Yeah.
It comes back. The donut hole comes back. It is being closed up, and it was intended to be closed up by 2020. Gone with the ACA repeal. Your employer-sponsored insurance, that's wonderful, isn't it? And you have all the benefits of preventive care and everything. And here in New York, rates rise every year. People forget that. I hear a lot of people scream and yell, oh, Obamacare. Oh, the cost is too much. The rates are insane. Insurance went up every year. All right, it's called inflation. It always has. Affordable Care Act, and especially in New York State, we have kept those rates low. for us. So I'm kind of losing my train here because I'm so freaking cold. But I have health insurance. So thank God if I get sick, I can get treated. But for all those people out there that won't have health insurance, for all those people that are Medicaid eligible, are going to lose it because we expanded Medicaid in New York State to reach working poor or people with lower incomes, hairdressers, tattooists, servers, the self-employed, farmers, all became eligible for Medicaid. We take away Medicaid expansion, they're all left out in the cold, and insurance becomes very unaffordable for somebody that's earning $18,000 a year, right?
Right.
Can you afford $200 a month for insurance?
No.
Well, no, it won't cost $200 a month because if we take away federal subsidies, we're going back to the way it was before the Affordable Care Act, when the most basic crappy plan you can imagine costs $960 a month with an incredibly high deductible. We don't want it. We don't want to go back, and we won't go back, will we? No! Absolutely not. So I am so proud to see everybody here and stand up for this fight. We at ACR Health are dedicated to fighting for the ACA and fighting for our livelihoods. We will be open for business to enroll you, to advocate for you, to help you fight. If an insurance company says, no, we're not going to pay for that prescription, tell them that, because we'll help you get it, okay? We will be here until they tell us not to be here. So thank you very much for inviting me, Joe. Thank you very much. Can I take a picture with everybody? Yeah. Do you mind? Because, I am kind of a big egotist.